Hello everyone, this is Aksar Haribov coming to you live from Digital Health Summit Studio, and I'm joined today by ANAND IYER with WellDoc. Hey, how is WellDoc involved in the digital health space?
That's a great question. We actually were fortunate to be one of the earliest members in this space way back when digital health was a brand new concept, and it was really born, Aksar, out of the frustration of an endocrinologist, right? Who, in her own words, trying to teach somebody how to manage diabetes is like trying to teach them how to manage a foreign language in just a couple of offices scattered throughout the year. And a simple question back in 2005 was, could technology help? Mm-hmm. But could technology help not just to collect data, but could you actually have patients act on the data? So if you could convert data to information, knowledge, and action. And what we ended up doing was starting a journey that has been an amazing journey, but it's a journey that took a life sciences approach to bringing the app to life versus just taking a standard app development approach. And so we actually built our first app, and what that did was two parts. One part faced off to the patient, mm-hmm. and it coached them on parameters. So if they put in parameters, their glucose values, their medications, their exercise, diet, whatever they put in, they got real-time coaching on what to do. And your feedback and my feedback would necessarily be different because your parameters and my parameters, mm-hmm. our medication history, et cetera, are different. It would also give the patient longitudinal feedback. So it would look for patterns over time. Mm-hmm. And it would educate them and give them, if you would, behavioral encouragement on kind of getting to the right pathway. The second part was directed towards the physician.
Gotcha.
So the system would step back and look at all the data, and in effect it would tell the doctor, hey, here's where they were, here's where they are, here's what's changed, here's what you should do, but you're the doctor, do what you think is right for your patient. And in that first clinical trial, we saw a 2-point A1C reduction with patients who used the product. Doctors were 5 times more likely to add a medication or change a medication when they got that report. And that started this life sciences journey that said clinical trials, FDA, get a drug code. And so what we really have today is Blue Star, the product, is prescribed by a doctor, mm-hmm. and the patient uses it. The doctor benefits from it in terms of their ability to better manage the patient. But the outcomes in the real world have been just dramatic, in some cases even better than what we saw in the clinical trials.
That's interesting. So essentially what you're saying is that WellDoc is providing both getting the data and then providing actionable insights versus like leaving the patient out to manage themselves.
Yeah, I think it's a good point in that any patient will tell you, tell me what to do. Mm-hmm. I don't need more graphs, I don't need more charts, right? I don't need more data. And now when you think about it, we're actually adding more and more to that problem. Now you have wearables, you have sensors, everything's on your watch. So it's like, okay, it's data overload. I think what they want to do is just tell me so real example, it's 4 o'clock in the afternoon, and I'm hungry, I want to go eat at a restaurant. What should I eat? What should I eat that will keep my glucose in range, rather than me trying to figure it out? And so I think it is important to convert. You need data, because otherwise you don't have anything driving the engine. Yep. But you need data, but it needs to be converted into information, knowledge, and action.
Right.
That then changes the patient's behavior now, but sustains that change over time.
Interesting. So that's exactly what is needed, in my opinion. What do you guys see as the most exciting thing for this year, for next year, that you guys are coming out with?
I think if you were to chart our journey to how we got here, mm-hmm. We got here in almost, I'd say, 3 phases. And the first phase was all clinical research. It was all about the science, publications, showing that Dr. Collins' quote from NIH is the absence of evidence, the evidence of absence. We need evidence. So we said we need evidence. Great. The second phase of the journey was, how do you build up a carrier quality, 5 nines quality platform, right. Scalable, good software, all that good stuff. The third one is, how do you actually commercialize in your business model? And kind of where we're headed now is we've got those 3, right? Now it's a matter of, there's different models that work for different payers. There's different models that work for different IDNs. There's different models that work for different diabetes centers. In some cases, they want to have this reimbursed through the pharmacy benefit pathway, and we have an NDC drug code for our product, so we can reimburse through that way. So it's prescribed, dispensed by the pharmacy, even though they're not dispensing a bottle of pills, they're dispensing a code, right? And it's paid through the pharma benefit. The second one is, I could have a closed form system, mm-hmm. Where I have what I call a standing order. And so at that point in time, I can make a rule that says, hey, any patient whose A1C is above 9 or above 8.5, whatever the number is, it gets Blue Star. And they get on it, and then they get down to goal quickly. And then we're actually contemplating, which is really exciting, we're contemplating how do you not just do the RX model, how do you do an over-the-counter model? So can there be a consumer version of this as well that's not only applicable here in the United States, but certainly around the globe? It's a big problem in diabetes, but they all have smartphones and they all have data plans and all of that's there, and they all use apps, right? And so I think that's going to be an exciting part. And then of course the other exciting part is how do you take this and how do you expand it to other chronic conditions? Because it's not just diabetes. Such solutions can help hypertension and obesity, and then you start to think about the other not cardiometabolic diseases like cancer and rheumatoid arthritis and pain management, and you can actually do a lot to help improve outcomes and sustain those outcomes.
Well, it definitely sounds like you guys are busy, and it sounds like you guys are doing some good work. Thank you, Anand. And this is Aksar Haribov coming to you live from Digital Health Summit Studio.